You're going to have lots of people here talking about very specific specialities. What I want to talk about is the fact that I'm doing quite a lot of things and the joy that psychiatry lets you do that. So I'm a clinical senior lecturer in psychiatry. I teach and research in psychopharmacology, particularly substance misuse and affective disorders. But I'm also a consultant in substance misuse psychiatry, so I run an inpatient unit and an outpatient team looking at substance misuse. I also work in the complex pain arena, working alongside other consultants in that area. And I have input into the liaison substance misuse team at one of the district general hospitals. No 2 days are the same. You're really engaging with people on their level. They have issues, difficulties, ways of dealing with things, many problems, and it's trying to get to the bottom of what's most important. You know, a perfect example is it's fine to be treating somebody's substance misuse and their liver failure, but if they're sleeping on a park bench, you've missed the whole point of the issue. So that's what's lovely. You're trying to help people with a wide range of issues. The paperwork, it just grows and grows and grows, and it definitely gets in the way. It doesn't interfere completely, you know, I wouldn't be here if it did, but it definitely is one of those, everything is measuring the process and missing the outcome. The best bit about psychiatry is, if you're interested, you can get in, okay? Because there's lots of jobs out there. It's one of those hidden specialities. You don't realize just how many of us there are. I started off thinking I'd be an A&E specialist or become an anaesthetist, and then I did 6 months of clinical research in psychopharmacology, just in passing, which morphed into 3.5 years of clinical research. Finished that as an MD, did some junior psychiatry training, came back to some more academic work, finished my psychiatry training, became an NHS consultant for 4 years, and then stepped across to become a clinical senior lecturer. So a bit of an accidental journey, and that's what's lovely. Most psychiatrists have done that. They start off somewhere and drift somewhere else. We're one of the few specialities left where you're looking at the whole person. They're not being brought to you with they're in this box, you must treat this part of them, nothing else. I would recommend time in psychiatry for anyone, whether for 6 months or longer, because actually psychiatry for primary care is 30% of your business, okay? You really don't want to be a GP principal starting your job, never having done psychiatry. 1 in 3 of your patients come in with that issue. 1 in 3 of patients in district general hospitals have psychiatric issues as part of the reason they're there. If you don't have that skill set, you're not going to do good for your patients. It's really fantastic. Have a go. You'll be sucked in.